That's one of the actual main themes of my present theme, was to actually look at the interdisciplinary care team involved in actually delivery of cancer therapies, also cancer care. So we actually have collaborate, educate, and compensate. Each have their own definition. Collaborate, being members of the interdisciplinary team. And again, we actually have people from the nutrition support team to our nurses, nurse practitioners, advanced care practitioners in these cases as well. We also have financial advocates, prescribers, and also pharmacists and social workers, just to name a few out there. We have this A to Z based definition of all of those people who are collaborating on delivering cancer therapy to the appropriate patient. And the names I've listed are just some examples of those people involved, but we can actually go on and on about endocrinologists who are focusing on cancer care. We can actually address social workers who are specific, and nurse navigators who are really kind of earmarking themselves into that line of care for the overall healthcare delivery system. As we start to focus more and more on these, we see the evolution of that care team, which at one time could have just been the actual physician and the nurse, now being expanded because the care delivery is becoming much more complicated, and we have to have people along the line of care to really integrate that piece. That's where collaborate comes from. Educate. Educating the members to understand what those actual services are. When we're looking at nutrition support and nutritionists, there's a large model there in which we're actually addressing our patients, making sure those patients are continuing on therapies for treatment, in which that includes food intake and other areas as well. And that's how we do that. And that's actually just the nutritionists. Social workers, their expansive knowledge base, working with many team members, educating them on the actual delivery of services, but educating the actual administrators on what that service provides. Because in many cases, we're working with a number of individuals. It could be oncology team members, it could be members of the actual personal team addressing care, like nurse navigators and several others. We can even look at, for example, caseworkers addressing that role too, and also financial advocates and pharmacy technicians, all being in that actual team. However, when we're looking at that, many people are unaware of the cancer delivery in the setting and who's involved with that. And that's educate. And when we take a look at compensate, the last part of my president's theme, that's really looking at members who are involved in the actual cancer care delivery and how to address compensation for their time. Not so much reimbursement, as in many cases we're dealing with uncompensated care models in our system, and that actually occurs throughout many different pathways of actual touch points with our patients. It's really addressing the time devoted to those patients and how to actually hopefully in the future actually understand what that cost is, to look at reimbursement methodologies or even payment methods in the near future to address that level of cancer care in our healthcare delivery system. So in looking through those pieces, we have a number of different players involved, pharmacy technicians. We have, again, psychologists or oncology psychologists in this case as well, and also even cardio-oncology, to name a few. Again, we also have molecular pathologists, next-generation sequences pieces, again, for tumor burden. So these are all part of the actual puzzle for the overall care model.